Greetings. Ken Kozel, President and CEO of Shore Regional Health, here to share some insights about our healthcare system's response to COVID-19. This week, I want to talk a little bit about numbers. Of the many questions that come my way each day, most start with how many? How many COVID-19 patients are in our hospitals? How many people have been tested? How many ventilators? How many beds? And so on. What I really want our community to know is that we report all of these numbers from each of our facilities to our 5 Midshore County health departments. With full transparency of our information, the health officer is then able to manage their respective counties throughout this pandemic. They then report all county information to the state health department, which in turn reports to the CDC and the federal government. Let me explain why. First, there are multiple testing avenues: emergency department and inpatient testing in the hospitals, and outpatient testing done by the health department, some primary care providers, and the drive-through at Chesapeake College. Thus, Shore Regional Health testing numbers are only partial and don't reflect an accurate picture for our region. We want you to have the whole picture and proper perspective. You should also know that because we are part of a healthcare system, things like equipment and ventilators, beds, masks, and other PPE is transferable, not just between our 3 hospitals, but between all hospitals in the system. Therefore, our capacity for managing patients ebbs and flows depending on the healthcare needs. This is the value of being part of a system. At this time, what we are seeing is not one big wave of surge throughout Maryland, but what we call a popcorn surge, occurring at different locations in Maryland at different times. This is enabling and Shore Regional Health to be nimble, allocating resources around the 13 hospitals responsibly when and where the demand presents. For example, last week, one of our hospitals accepted a COVID-19 patient from Capital Region due to the surge in progress at Prince George's County. At the same time, we transferred a local COVID-19 patient to the University of Maryland Medical Center in Baltimore due to complex healthcare issues that UMMC is better able to manage. This is the beauty of being part of a large, advanced, and well-resourced healthcare system, in which all hospitals are working together to assess and share resources in a way that improves healthcare outcomes for patients throughout Maryland. Before I sign off, there is a matter of some urgency I want to share. Across the system, we have a concern that people who need medical attention for a variety of healthcare issues and symptoms may be delaying getting care. Each of our 3 hospitals, our emergency center, and many of our provider offices are seeing a much smaller number of patients than normal, possibly because patients assume there is risk in going to the doctor, to the urgent care center, or to the local emergency department. The real risk is that whatever the healthcare issue is, if care is delayed, it may worsen. All of us at Shore Regional Health urge you, if there is a health issue for you or your family member, do not delay getting the care that is needed. A few things to know. If it's a situation that's life-threatening, of course you should call 911. If it's emergent but not life-threatening, an important message for our listeners to know is that our 4 emergency departments are all open, are treating patients, and are safe places to seek care if needed. Our urgent care locations in Easton and Denton are seeing patients and are open to care for you. Many providers are offering appointments by telemedicine, which means video conferencing. Call your provider's office to share your medical care need and see if that can be arranged for you. I hope that this information is helpful. I plan to continue putting these short videos out as a way of keeping our community informed about what's happening here at Shore in regard to COVID-19. Thank you for your time and partnership in tackling this virus. And until next time, stay safe.